Unfortunately, we have a ticking time clock that Medicare potentially may go bankrupt by 2033 if we don't do something.
Cases that Dr. Oz and I have seen recently on the Medicaid side of the house, they're getting paid $6,000 a month for people allegedly on hospice and putting them in group homes where they aren't even providing them with good food or good surroundings. They have moldy food, unclean surroundings, and they call them six packs. They put 6 people to a home in these California suburbs, and they get $36,000 a month for not providing any services at all under the guise of it being hospice services. That's what we want to stop, and that's unacceptable. Right now, CMS covers 170 million Americans between Medicare, Medicaid, and the marketplace. Every day for Medicare, because of the baby boomer generation, until 2030, we will enroll 10,000 new beneficiaries every day onto the program, and then at a certain point, 2030, that starts to tail off.
You're going to love this article. In the article, Tom, they asked him, how did the 6-month benefit for hospice come to be? And he literally said it was the 12th hour to get the legislation done. And someone said, wait a minute, we can't leave this open. And so they literally pulled 6 months out of the air. It wasn't evidence-based medicine. Every one of us purchases Amazon every day, and we look at those ratings, and they had a bunch of 1 and 2s. I'm not going to order that product. But yet, well over half of hospice in America don't have to report that part of the data. That feels like a problem to be fixed.
There's now, just in LA County, 1,800 hospices that are listed. That's 4.5 times more than the number of Starbucks in LA, just to put it in perspective. And so as a result, we believe that upwards of 900 to 1,000 of those are just completely false. So almost 50%. One of the most common scams is to just send people to someone's door and say, hey, would you like a 40-inch TV? In exchange, if you sign this, you get a 40-inch TV and we'll come by and you might get some light housekeeping or something like that. And instead, sort of like I told you with the 6-pack example earlier in this episode, they get paid thousands of dollars a month. And legitimately, the beneficiary doesn't get anything for that. We sent thousands of letters out in California, Nevada, and Arizona to all of the people who have allegedly elected hospice. And we've had a high hit rate of people writing back and saying, I'm not signed up for hospice. I never agreed to be on hospice.
As you've already learned, the majority of hospice people are just kind, caring, beautiful-hearted people. But he said collegiality ends at criminality. First hospice that I grew up in, I was 25 when I came to work for it. One of their key adages is we add life to days when days can't be added to life. I've known about some of this stuff for a while, and it's like, why is no one doing anything about this? And so kudos to you guys that you are doing something about it.